Sir, pwede pong pataas po ng damit ninyo. Check ko lang po kung meron pong mga irregularity sa dibdib nyo or any discoloration or any abnormality sa pattern of breathing. Hinga lang po kayo ng normal. Okay? So after doing inspection, we need to proceed to palpation. So sir, for the palpation naman po, gagawin ko po, hahawakan ko po yung dibdib ninyo, and then sasabihin niyo po kung may mga area na masakit, okay? Masakit po. Dito po. Dito naman po sa gilid. Wala naman po. Okay, so after palpation, we need to do the tactile fremitus. So for the tactile fremitus, sir, isa-check ko lang po ulit yung dibdib nyo, and then pag nilapat ko po itong pangapalad ko sa dibdib nyo, sasabihin nyo po is 99 para ma-check ko lang po yung tactile fremitus. Okay, 99. 99. 99. Okay, after doing palpation, we now proceed to the percussion. So for the percussion naman, sir, parang gagawin ko is parang itatap ko yung dibdib nyo na parang tambol, and then papakiramdaman ko lang kung merong abnormality sa dibdib nyo.
Good morning po.
Good morning.
I'm Francis Dingal and I'm going to perform auscultation of the anterior chest and lungs physical examination. Is that okay po ba?
Okay.
First, ask the patient to cough once to clear mild atelectasis or to clear mucus. Then, listen to breath sounds. Pwede po ba kayong umubo ng isang beses? In real practice, you should also ask the patient to remove his clothing or remove his shirt. Ask the patient to breathe deeply through an open mouth. Hinga po kayong malalim ng tuloy-tuloy gamit po yung bibig. Note for the characteristics of the sounds. Assess the pitch, intensity, and duration of both the inspiratory and expiratory sounds. Note also for the presence of adventitious sounds. If identified, take note of its characteristics and location. If indicated, listen also for the transmitted voice sounds.
For the next part, we will be inspecting the posterior chest. So to do this, we just simply observe for any masses, scars, or lesions that may be present on the patient's back. Next, we will be doing assessment of the posterior chest expansion. So to do this, we just simply place both of our hands tightly on the patient's back and ask the patient to breathe in deeply and out. So breathe in and out, in and out, in and out. A unilaterally reduced chest expansion might indicate pneumonia or lung collapse. Next, we will be percussing the patient's posterior chest. So to do this, we ask the patient to fold both of his arms. Then we tap on the patient's back using the third finger, by tapping on the third finger of the opposite third finger. So we do this in a ladder-like pattern. Normally, the sound should be resonant. A dullness might indicate consolidation or collapse. A stony dullness might indicate pleural effusion, and hyperresonance might indicate pneumothorax.
Good morning po. My name is Francis Dingal and I'm going to perform auscultation of the posterior chest and lungs physical examination. Okay lang po ba? First, ask the patient to cough once to clear mild atelectasis or to clear mucus. And then listen to breath sounds. Pwede po ba kayong umubo ng isang beses? And then ask the patient to remove his clothing. Okay lang po bang pakitanggal yung t-shirt niyo?
Yeah.
Then ask the patient to breathe deeply through an open mouth. Hinga po kayong malalim ng tuloy-tuloy gamit po yung bibig. Note for the characteristics of the sounds. Normal breath sounds, such as the vesicular sounds, are soft and low pitch and heard over most of the lungs. Bronchovesicular sounds are of intermediate intensity and is heard at the first and second intercostal spaces. Bronchial sounds are loud sounds, while tracheal sounds are very loud. To reiterate, I'm auscultating in a ladder pattern. Assess the pitch, intensity, and duration of both the inspiratory and expiratory sounds. Note also for the presence of adventitious sounds. If identified, take note also for the characteristics and location of the sounds. These are the continuous wheezes and bronchi and the discontinuous crackles. To test for vocal resonance or transmitted voice sounds, ask the patient to say 99 repeatedly. Sabihin niyo po yung 99 ng tuloy-tuloy.
99, 99, 99, 99.
Louder or audible voice sounds rather than the muffled or indistinct sounds indicate the presence of bronchophony.
99, 99, 99, 99, 99, 99, 99.